Good evening.
Good
Hello,
evening,
Albert, madam. Good
everybody.
evening.
And I welcome you all to the DNB webinar series. And today yet we have a very interesting topic taken with in our seminar series for the second time by Dr. Shashank Budhakar. And I'm really thankful to him because this topic, he really simplifies it, which is a topic which is very confusing to all of us and also to the residents. And he's done it last time as well. In fact, we did it in two parts last time, if I remember well, Dr. Shashank.
Yeah.
He had it over a period of 2 days. Today, he has simplified it, and we're having a maybe a little longer session today, but I'm sure he's going to make it very interesting. Well, what can I say about Dr. Shashank? An avid anesthesiologist who's had more than 35 years in anesthesia practice, has been at Leelavati Hospital, and before that, he has been in UK and has been trained from Nair Hospital. And at present, he has just retired and hung up his boots in anesthesia, and he is now venturing for better pastures, I believe. So, Dr. Shashank, whatever other fields that you go in, we will always want you to come and teach our residents about biostats. So, I thank you and I welcome you on this platform, and this floor is all yours.
Thank you, Kalpana, for the introduction. So good. I was expecting that only 15 will join, but many are interested, I think, still in the topic. So nice to see many participants here. So what I'm going to do is basically keep this interactive so that we can communicate. So not through your mic, but we'll interact through the chat box. So all the students welcome. And just to initiate the chat, can you type hi in the chat box so I let know that everybody can use the chat box? So all students just type hi. Yeah, good. Excellent. So we'll time in between, we'll interact to the chat box so that I can get the acknowledgement from you. Nice. So how many of the students feel that this topic statistics is very boring? Just be frank. Type B for boring and NB for not boring. Let me see how many. Yeah. Good. Keep on typing. I want everybody to participate so that I know what's the mood. At least one is saying not boring. Saji. So yeah, majority of them feel it's boring. I do accept that because initially when I started reading statistics myself, it was boring. It's mainly boring because the books make it boring. If somebody can explain it in a simpler fashion, it is not that boring. And I hope to do that today. So let's begin. I'll just start. Okay. So what I'm going to do is, as a student, you go through your initiation of the thesis, and then you recruit the patients, and then you write the protocols and everything. So we'll go through step by step. So the first year student understand it well. The final year student have already done it. So they would know what are the different steps when you do the thesis. So these are the exam questions. So this time I think this was asked. Yeah, normal distribution was asked. Let me check the pen. Okay, so this time I think you had power of the study, p-value that was asked. And if I go back, I think normal distribution was asked. So 3 questions were asked. So majority of the times from the statistics, there are very limited questions they ask. So, and we are going to cover around 60 to 70% of those questions. Okay, so The first year students start with picking up a research topic. So how to pick a research topic? It should be simple. It should be ethical. So basically not harmful for the patients. It should be feasible. So whatever topic you choose, the facilities should be there in your hospital. It should have a clinical relevance so that it makes you interesting to do that thesis and complete the thesis faster. And how do you choose the topic is you go through peer-reviewed journals for the last 2 years and get an idea what sort of original literature is there on the research. And plus, if there is something interesting, some new thing has come in your department, maybe new drugs, maybe new technology, new equipments, and you can choose one of those to start your research topic. So once you have decided upon the research topic, the next thing you do is write a study protocol. So in the study protocol, you have to mention what study design you're going to use. Most of the times as a students, it's an observational randomized control trial, which is allowed in the institutes. You have to choose a sample size. So for that, you have to take the help of a statistician. And then you should have a clear inclusion exclusion criteria. That is important because this criteria is going to be applied to the population once the study is validated. And you should have clear primary and secondary outcomes. Again, that will help for you because validation depends upon your outcomes also. And then you should have a planned statistical test, which all this is done right in the beginning before you start your study. So this part of the writing of protocol needs a lot of help from your teacher as well as the statistician. And then once the protocol is done, you have to present this protocol to the ethics committee. So the ethics committee will review your protocol, see that it is balanced in all matters. Then it also should see that there is a participant protection. All the patients who are enrolled in the trial should be informed very well regarding advantages as well as the disadvantages. There should be no conflict of interest. What I mean by that is nobody from the equipment lobby or from the pharma lobby should have an interest in your trial. So it should be neutral. The methodology of the trial should be perfect so that it is according to the standards of the protocols. There should be a benefit and legally it should be safe for the patient who are enrolled. There should be data privacy, which the institute will look into it. And the ethics committee continually reviews and monitors your study. So especially the research department in all institutes are very helpful in that. Whatever issues you have, you can go back to them and they will resolve them quickly. And also they give you feedback and recommendations from time to time. So ethics committee is of great help, and it's a requisite for a trial to be first presented to the ethics committee. And only after the ethics committee gives a go-ahead, then you can go and start your thesis. So who are the ethics committee members? It is a multidisciplinary team where you have representatives from the institute as well as from the community. They may include medical professionals, they may include scientists and researchers, and especially important person is the statistician and data analyst. Plus, sometimes you have advocates who can represent your ethics committee. And in general, you have a team of 7 to 15 members. And for a person who is doing the trial and presenting it to the ethics committee, at least a quorum of 5 is required for it to be a valid ethics committee meeting. And the chairperson of the ethics committee should not be from the hospital. It should be from the person who is outside the hospital. Now let's start with some few topics which are important for a student to understand. Sample size is one of them. Sample size is the number required to confidently answer the research question. So the statistician in the beginning will look into what study you're doing, what are the variables. So what are the various factors which go into deciding the sample size is the estimate of the proposed difference, which is called the effect size. So for example, let's suppose you are doing a study on pain relief. So the outcome measure will be your VAS score from 0 to 10. And then you would like to know how much difference would be valid for you. Let's say the one mean would be a VAS score of 3. And in the other group, which you are which you are studying, the VAS score may be 7. So the difference is 4 points. So the statistician will ask you this effect size, how much difference you are ready to accept. In terms of success rate of blocks, they may ask you, is the 10% or 15% success rate you are happy with? Or maybe if you are studying difference between the recovery of the patient from agents like propofol, or if you are using another agent like gas desflurane or sevoflurane, you would like to know whether the difference of 5 minutes or 10 minutes of effect size is adequate for you to. So this effect size difference is important because as you choose the effect size smaller and smaller, the size of the sample will be increased. Second, he will ask you about the degree of power which is required. So generally the degree which is taken is around 80%. We'll go into the details of what is power of the study. Then he will ask you about the level of significance, which is generally taken as 5%. Again, we'll go into the details of what is significance. And he will ask what are the variation you are expecting in your study. So that parameter is important. And lastly, he will ask you about whether you want to do one-tailed or two-tailed test. Now, the difference between one-tailed and two-tailed, we'll come to it later. But just shortly, I will tell you that if you want to know whether your drug which is under study is how much better it is than the control, then you need just one-tailed study. But if you want to know whether your drug is better or worse than the control, then you need a two-tailed study. So there is a difference between one-tailed and two-tailed study. The sample size required for two-tailed study is more than what is required in the one-tailed study. So importance of sample size is it gives a good statistical power if the sample size is appropriate. It gives a good precision of the estimates, which is the effect size which I was talking about. Then if your sample size is adequate for the study, the whole study can be generalized to the population. It minimizes the bias. And if the sample size is adequate, it can help you to do subgroup analysis. And obviously, there should be resource optimization. So you should not have a very big sample size because then that will use up the more resources. So common mistakes in sample size calculation is underestimating the required sample size. So the statistician will help you to prevent that. Overestimating the effect size. So if you're overestimating the effect size, that is the difference which you want to know, then a larger size sample is required. Ignoring the variability. If you don't know the variability in your study, you should go back and look at similar studies, which will tell you how much variability is in. And this is important because this is one of the parameters which is used in calculation of the sample size. Also, when you get to the number of the sample size, you should also think about the dropouts. So whatever the statistician has told you per group sample, let's say it is 30 or maybe 40, you should add more to this, at least 10, because you may have dropouts in your samples. Using incorrect statistical methods also can give you wrong results for that particular sample size, and neglecting power or significance. So power and significance we'll learn about this. So these are the formulas. So as a clinician, you're not expected to know the mathematical calculation that goes behind this sample size. But you should be aware that there are sample size which are different for when you compare means and when you compare proportions. So we'll come to the details of what you mean by means and proportions. And these are other common formulas which are used for standard deviation, z-score, standard error, confidence intervals, effect size, and pool. So you're not expected to know the mathematical calculations, but these are the terms which you will come across and I'll explain to you. Okay, so up till now, is the sample size clear? Just type it in the chat box so I know that at least sample size is clear to everybody. Say yes if you are okay with sample size. So type in your chat box. All participate so that I know that everybody is, yeah, good. So sample size is clear. So sample size is an important theoretical topic which we have covered now. Now we'll move. So now what I want to do is give you a panoramic picture of what happens when you do a study. So let's suppose that you have started your randomized control trial. What happens is once the study has started, you have two groups. You may have more than two groups, but for this example, I'm taking two groups. One is the control group, one is the study group. Now, what do you do with these two groups? You collect the data from both the groups. Once you have collected the data, you would put it into the statistical software, which will give you descriptive statistics and inferential statistics. Any one of you can tell me for clinical trials, which is the statistical software we use? Anybody can type if somebody knows. Commonly used software. This can be asked in your Viva exams. Anybody knows? So the common software that is used for statistics is called as SPSS. This is very common from ages. This software has been used. The current version is the version 31 for 2025. So SPSS is the statistical software which is used. So this can be asked as a Viva question on your tables. So once the data is collected, the software will analyze the descriptive statistics. It will analyze the inferential statistics, and it will apply appropriate test for that particular data. So lot of the test will depend upon what type of data is in the input of that particular software. We'll learn this later, and that after application of test, you will get a Z statistics, which will tell you whether there is or there is no difference in the two groups you are studying. Now, if there is a difference, it will tell you whether the difference is real or it is just by chance you got those difference. And from this difference, you can get two estimates of chance. One is the p-value, and one is called the 95% confidence interval. So now more and more studies tell you about the confidence intervals rather than the p-value, and we'll look into the difference of these two later. So this is how I wanted to give you a panoramic view of how the whole process is done. So is everybody understood the whole panoramic process? Just tell me. Yes, Bhavya Patel has written Excel. Yeah, Excel is one of the software they can use, but SPSS is the ready-made software. So is everybody clear about the panoramic view of all the whole procedure that goes behind doing a trial? Great. Excellent. So everybody is still in sync with me. Okay. So now we'll start doing a little short topics and go into the details of each. So whenever you start a trial, it is initially important that you have an hypothesis testing. Now, for ages together, it is the null hypothesis that everybody starts with. So what does null hypothesis assume? It assumes that whatever number of groups you're studying, there is no difference between these two groups. So that is what the null means, that both the groups, your control as well as the interventional group, it assumes, or the researcher starts with an assumption that there is no difference between these two. This is called as null hypothesis, or it is denoted as HO, H0. But when you are doing the study, you don't want that null hypothesis. Okay. So you're initially assuming that your two groups are the same. But as a researcher, do you want a null hypothesis to be true? No. You want that there is a difference between these two groups, and the difference between the two groups, what hypothesis we accept is called as alternate hypothesis. So as a researcher, you're not willing to accept the null hypothesis. What you want to accept is called as an alternate hypothesis, where you assume that there is a difference between those two groups. But it is a trend to start with a null hypothesis. But as a researcher, you want to reach to the alternate hypothesis. Okay, so null hypothesis is a claim or statement about population parameter that is assumed to be true until it is declared to be false. It plays important role in testing the significance of difference in experiments and between observations. So HO is the symbol. It presumes to be true until rejected by the testing, by testing its probability. So it is tested by taking sample from a population under study. To accept or reject a null hypothesis, alpha level is decisive. So we'll come to this, what you mean by alpha value. It is also called as significance level. The aim of the researcher is to reject the null hypothesis, thereby accepting alternate hypothesis, which indicates that there might be real difference between the two groups, and that difference is not by chance. There is something which causing the difference between these two groups. Okay, now we come to another important topic called as randomization. So randomization is a very important process when you recruit the patients for your study. What randomization means is it's a process assigning the patients by chance. So every patient has got a equal chance of entering either into the control group or to the intervention group. It is used to get reliable answers to the research questions. It helps to prevent bias. So what type of bias I'm talking here is the selection bias. So researcher should not have a selection bias of choosing a particular patient to one of the two groups, or one of the which are how many ever groups you're looking into. Each patient should have equal chance. So it ensures comparability between the groups. It enhances the statistical validity, and it supports ethical conduct. So what are the types of randomization? Majorly in the books, you will be seeing these 4 types of randomization. One is called as simple random sampling. Second is systematic random sampling. Third is the stratified random sampling. And the fourth is the cluster random sampling. So most of the textbooks will give you these 4 types of randomization. So we'll look into the details of each. So in simple randomization, it involves drawing cheats or using a computer number generator. So as a students, most of the institutes will use this type of simple randomization, where once you get the number of sample size, you draw cheats of all those numbers and you divide into 2, and you randomly select a cheat. It could be done by manually by selecting a cheat, or it could be done by a computer. So advantage of this type of sampling is it's easy to implement. it maintains allocation concealment, and it's best for large samples. Disadvantage is that there may be potential imbalance. I'll tell you what this imbalance means soon. And there is no control over the covariates. Again, we'll go into the details of what do I mean by covariates. Okay, so this is simple randomization. So this is how it is done. It can be done by flicking a coin also, which has a 50-50 probability of each candidate being divided into two groups. And it is good, as I said, for large size samples. For smaller size samples, you can end up with unequal size of the groups. So this is simple random. So then we come to what is systematic randomization. So systematic randomization is the method which involves choosing a fixed or periodic pattern for assigning participants. So in simple words, you can choose every alternate patient to go into each groups, or if there are three groups, you can say first one will go in one group, second will second, third in the third group, then fourth again will go into the first group, fifth again will go into the second group, and sixth will go into the third group. So it's a very simplistic way, but it's not commonly used, this type of randomization. Though simple and it causes even distribution, the disadvantage is that there is predictability. That means if the first person has gone to the control group, we know that the second is going to the intervention group. So there is no chance which is there into distribution in randomization. So each person does not have an equal chance of going either to the control group or to the intervention group. So there is a predictability which is not good when you're doing randomization, and there is a risk of bias. This third is the stratified randomization. And now this is again very commonly used. It combines your simple randomization along with your stratified randomization. Now, what do I mean by stratified is this involves matching attributes between groups to ensure balanced prognostic factors. So in simple terms, let's say you have two groups, you want those two groups to be balanced with equal number of males and females. You want them to be balanced with equal number of ASA1 and 2 groups if you're including only ASA1 and 2. Or if you're including 3 and 4, again, it should be equally balanced between these two groups. So this gives more meaning to the study, and such study where the attributes are matched very well in between these two groups, those studies are more validated, and those studies could be projected well when you are thinking about applying to the population. So it balances prognostic. So advantages are it balances prognostic factors. It's useful in smaller trials, and it can be used in multi-center trials. Disadvantage, it's more complex, but not anymore, because computer can help you, or even simple using the cheats also you can divide the groups into stratas. And disadvantage is that it's a limited number of strata. So let's suppose you wanted multiple stratas, like you wanted to match male and females, you wanted to match ASA1 and 2, you wanted to match 3 and 4 as well. So then it becomes more number of strata. Then if you use more number of strata, the number of sample size will increase accordingly. So how do you do it? The stratified sampling is, so initially you divide the strata into two here. So let's suppose you have males and females, you have stratified first, and then you can use simple randomization to distribute between the control and the intervention group. Similarly, you can choose ASA1 here, put ASA2 here, and then divide them into control and intervention group. So this is how stratified randomization is commonly used, because it matches the two groups very well. Then you come across cluster randomization. Now, this method is rarely used because it involves randomizing a cluster, not one participant or two participants separately, individually, but uses a cluster. So examples of this is, let's suppose you have two ICUs in your hospital and you want to use different protocol for infection control. So in one ICU, you can have one protocol, and in the second ICU, you can have another protocol for infection control. And then you can match this. So why? So these two ICU becomes two clusters. So, but advantage is that you can avoid contamination. Administrative convenience is there, but disadvantage is that large sample size is needed. Imbalance can occur in the cluster. So you cannot say, let's suppose one of your ICU has less number of patients, but the other ICU has no large number of patients. So there will be imbalance in the cluster number. And the analysis, when statistical analysis, which is done in this type of cluster randomization, is a complex analysis. And then there are modern types of randomization where computerization is used. So this first group is where you balance of two groups, sizes are matched, and the types is block randomization, permitted block randomization, on randomization. And here in this group, you balance not only the group size, but also the attributes, which I told, male, females, or ASA 1, 2, that is also matched. So in this, you have stratified block randomization, adaptive randomization, which have got two varieties: response adaptive and covariative adaptive. Now, I don't expect you to remember all this, because these are complex way in which randomization is done. But luckily, this is all done through computer. So in larger multi-center trials where an experienced researcher is there, he probably will choose this modern type of randomization. So is everybody clear of what randomization means? I've tried to use very simplification works and give you examples. So just let me acknowledge how is the randomization topic clear to all? Okay, participate. Everybody should participate, so I can get a good feedback. Okay, only two have typed yes, so the rest of them are they sleeping? Are they bored? No, good. I think reaching to the chat box was difficult. Excellent. So there is no no's. So is the pace okay, with which I am going, or do you want me to slow down?
I think it's perfect.
Perfect. Okay, good. So another topic is done. Now we'll come to another important topic. So what I'll do is wherever possible, I'll give you examples as I have given you in the previous topics, so that it becomes easier for you to understand. So let's come to the topic of blinding. So blinding is a procedure in which one or more parties in a trial are kept unaware of the treatment arm allocation of the participant. So it tells you exactly what the blinding means, that one or multiple participants which are taking part into the trial, one or more persons are kept blinded. So who can be kept blinded is the patient, then the investigator, then the team collecting the outcome data, and the data analyst itself. So there are four type of persons who can be blinded. So it avoids intentional bias during execution of the trial. So what are the types of blinding? The first is open label, or it's called as unblinded, single blinded trials, double blinded trials, and triple blinded trials. So we'll go into the details of each. So unblinded trials where all the participants are aware of the intervention. So in certain situation, blinding is not possible. So let's take an example. Let's suppose you are comparing general anesthesia versus regional anesthesia for hip surgeries. Now here, nobody can be blind. The patient knows what type of anesthesia he is receiving. The researcher knows what type of anesthesia he is giving. So nobody is blind here. So this is called as unblinded trial. In case of let's say surgery, if there is a particular surgery, new surgery which has come, which is better than the old surgery, then the patient has to be explained that you are undergoing this newer surgery as compared to the old surgery. So again, nobody is blind here. The patient knows what intervention he's undergoing, and the surgeon also knows. So there is no control group here. So this is called as unblinded trial. Then we have a single blinded trial where either the patient or the researcher is kept blind. So, so example, and most of the time it's the patient which is kept blind. So example of such trials would be, let's suppose you are comparing two types of supraglottic airways. You're either supreme LMA or your IGL. So the researcher knows what he is using. Only the patient, because he is anesthetized, will not know. So this is called as single blind trial. Now, double blind trial where the patient and as well as the researcher is blind. So this is the best form of controlled trial design, and all over the world, whenever the trial is done, most of them are double blinded trial. So it decreases the chance of observational bias. So example for a double blinded trial would be, let's suppose, what could be a good example in double blind trial is you are using an analgesics. Let's say you are using a pain relief medicine as a post-op pain relief for epidural, and you have chosen two different type of concentrations. So it is possible that the syringes can be covered with without telling you the concentration of the medicine. So here the patient as well as the researcher doesn't know what concentration you're using. So only here the person who is taking the data might know what type of blinding is done. And the third type of blinding is triple blinded trial, where all three are blind, where patient is also blind, the researcher is blind, as well as the person who goes into the ward to take the data from the patient. Let's suppose you are doing a trial on pain relief. So the VAS score, the person who is asking the patient about the VAS score is blinded. He doesn't know which type of medication the patient has received. And the last one was, as I said, the analyst also will be blinded. So everybody is clear about blinding now? With the example I have given, is it more clear what blinding is? Okay, excellent. Great. Okay. So now you've done the randomization, you have done the blinding, and now you get all the data. Now, what do you do with the data? Is you give it to the statistician. He will feed it into the statistical software. As I told you, SPSS is the common software that is used, and he will give you descriptive statistics as well as the inferential statistics. So in the panoramic talk which I had given you initially, we have come to the stage where now data is put into the statistical patch. But I'll explain you what descriptive statistics means and what the inferential statistics means. So descriptive means you describe what is the central measure. So in the central measure, you collect the data, and if the data is not skewed, so all the readings are nearby each other, then that data where you can have a numerical value, you can measure the mean. as a central measure. Okay. And then, so let me take remove the so in case the data is where you can find a mean, the mean will be used. And when will the median be used? Because when the data is skewed like this, so let's suppose these are weights of the patient, and you see the first 4 weights are good, but then one of the patient is very obese. So this is called as a skewed data. And when if you try to take mean of this data, it will give you a wrong measure of the central tendency of the data. So in such cases where the data is skewed, you arrange the data in ascending or descending order, and you take the median value. So this is done when the data is skewed. So these are the central measures. Then what are the measures of the spread or variation which you get, normal biological variation? So this distribution measure is called as standard deviation and interquartile range. So whenever you take mean as a measure of the central tendency, you will use standard deviation as the distribution measure. And whenever you take median as the central tendency, you will use an interquartile range as a measure of distribution. Okay, so now we move to another topic called as normal distribution. Now this topic was asked in this last theory exam, which was last month, which happened. So let's understand normal distribution, and it's very important topic because many of the statistical test will depend upon whether the data was normally distributed or it was a skewed data. So let's this is the let's take weights or not weights. Let's take the height. So this slide is showing that here are the persons with different heights. Now let's put this in our central measures and deviation measures. So what will happen is you will get all these persons with different variable heights distributed. Some will be of smaller heights, some will be of higher heights than the mean of the what you get. But there will be some persons who are very small and who are very bigger in heights. So these are called as outliers. Okay. And how do you know that these are outliers? Because you have set a particular limit. These limits are called as significance levels or alpha levels. Okay. Since you have set a limit of what you are going to say is normal, anything away from normal would be an outlier, and that is called as setting a limit. So this limits, generally what we set is 2 standard deviation. So if you see at the bottom, you have 1 standard deviation on either side. So around the mean, you will have some values which are higher in value, some values which are lower in value. And that is how, if you spread this value to include 2 standard deviation. Now what is the meaning of 1 standard deviation? In 1 standard deviation, you include around 68% of the populations. And when you spread that standard deviation to 2 standard deviation, you include 95% of the population. Now in the studies, before you comment that the 2 groups are totally different from each other, each group should include 2 standard deviation as the normal variation. Okay. So only after considering 95% of the population being in the normal distribution curve, any values which come beyond this 95% would be considered as different from the group. Okay. So in practice, we take 68% as one standard deviation and 1.96 as a 95% deviation. Generally, we restrict to the 2 standard deviation, but some studies do consider 99% of the variation. These studies are very tighter studies and you need a larger sample size for those. So in this slide where we are considering the height of the persons, the mean height is 170 centimeters, let's say, for example, and the 2 standard deviation is 9.5 centimeters. So if you plus and minus from this 170 centimeter, you will get a normal variation 151 to 188 as a normal variation. And anything outside this, either a higher side or on the lower side, like this, will be considered as an outlier. So clear normal distribution. Is everybody understanding what I mean by normal distribution? Very important concept. And again, in later slide, we'll be talking about normal distribution. Good. Excellent. So my pace, I think, is okay for you to understand what I'm talking. Great. Okay. So you see, this is called as the right tail and this is called as the left tail. Okay. You see here, right tail. So what I was talking initially when we were calculating the sample size, where you have to tell the statistician whether you're going to do one tail test or two tail test. So this is the right tail and the left tail. So if you're doing calculations for both the tails, then the sample size will be larger. If you're going to analyze only one tail, then the sample size will be small. So in practice, you will not get a very good curve like this, but there will be various curve where there will be lot of variation. And in a normal distribution, when there is a lot of variation, that means the final decision will be less powerful. You should have a normal distribution curve which is as narrow as possible. Okay, so you have seen what is normal distribution. Now let us see what do you mean by a skewed distribution. So if you see in this curve, this side of the tail is looking good, but this side is skewed. So this is called as positively skewed because higher values are on this side, right side of the tail. And if you go to the right side, the tail which is skewed is negative. Now, this doesn't mean that the values are positive or negative. Positive skewed means you are considering the values which are on the right side of the mean. And negative skewed means you are considering values which are left side of the mean. Okay. But in both these cases, the values are skewed and hence it cannot be called as normal distribution. Now, how do you test the distribution? When you have a data, there are certain tests which are called as a Smirnov or Shapiro-Wilk test. So the statistician does this test before applying the test to know whether the data which you have got is normally distributed or it is a skewed distribution. Now, whatever tests are applied on normal distribution are very powerful tests. So for any researcher, you would want to have a normal distribution. But in case if your distribution is skewed, there are certain methods which can be applied to make that skewed data into normal distribution data. What are these? So you can transform the data by taking logarithm, square root, or reciprocal of the data. Now, these are certain methods that statistician will do if he can rescue the skewed data and make it a normal data, these are certain transformations which he can do. Okay, now the topic of normal distribution is over. Is everybody okay with normal distribution? Because normal distribution, we are going to touch it again when we go into the what type of test we are going to apply. Just give me an acknowledgement if the normal distribution topic is clear from your chat box. Oh, great. So now we move from descriptive statistics to inferential statistics. Now what, as the word says, here we get the inference about the difference between the two groups. So what are these inferential statistics? Is significance test, which will give you p-value and which will give you confidence intervals. Now, what are the denotations? When you're doing the study, you are analyzing a sample and the denotation for mean is X and standard deviation is capital S. And when we are talking about population, the denotation for mean is mu and for standard deviation is sigma. So these are standard denotations which you will find in all books. Okay. So now, which statistical test to perform? Now we are getting to a very interesting part of the talk. So which test to perform depends upon three things. One is the type of data, distribution of the data, and the number of groups you are going to compare. Now, wake up and pay attention to the next slide, because most of the importance of what statistical tests are to be performed is in the next slide. Okay, so let's see what are the different types of data. So you have something called as continuous data. By means of continuous data is you can measure them in decimals. So like you can, like a weight, you can measure in decimals, like heart rate, not heart rate, but heart rate and blood pressure. These are continuous data, numerical data. They, though they may not have decimals, but still they can be measured on a continuous scale. And there is other type of data, so this can take any value of range between age and weight. Now, there is another type of data which is called as categorical data. So this data cannot be measured on a scale and they have no numerical value. They can be only counted. So example is nominal binary. Example is like male and female, or if you're considering how many patients vomited or not vomited. Or it can be nominal multi-category, where you will have data like agree, disagree, don't agree. They don't have a fixed distance between each other. It's very subjective. Nominal category data is very subjective, but still they have a category. So that is why it is called as nominal category. Then we have a third type of data, which is called as a ranked category. So in a ranked category, our usual examples will be hierarchy, like the Malampati score or your ASA scoring, where you have a category, and as you go from right to left, the degree of difficulty is evident. So here again, in the data, we have considered the type of data, continuous, ranked category, and categorical. But there is another thing also which needs to be noted, is on the left side, you have a normal distribution data, whereas in the center, you have a skewed data. Whereas for right, it doesn't matter whether it's normally normal distribution or not. So distribution is only important when you're considering to apply tests for continuous data and ranked category data. Okay. So in case of in the left hand side, if the data is continuous, as I said, you will apply, you'll calculate mean, standard deviation, and standard error. In case the data is skewed, you will calculate the median and the interquartile range. And in case the data is categorical, then you calculate frequencies and percentages. Now, what are the type of tests which are valid on the left hand side when the data is continuous and normal? So as I said, the third important thing is the number of groups you're taking into consideration. So in continuous data, which is normally distributed, and you have one group, then you use a paired t-test. If you have two groups, you use unpaired t-test. If you have three or more groups, you will use ANOVA test. In full form, it is called as analysis of variance. So let me give you an example of each. So example of paired t-test is like, let's say you are you want to curb the intubation response, and you're using say xylocaine to curb the response. Then you would take a data before intubation. What are the before the patient is anesthetized, you would take the parameters like heart rate and blood pressure. And then once you induce the patient and you have given xylocaine IV 60 seconds before, then you want to know how much effect that medicine has had on the intubation response. So here the data is from the same patient, but you are taking before and after the intervention. So such data is called as paired data. And for unpaired data, it's like you're comparing two groups with two different, one is control group and one is your intervention group. And then in analysis of variance, you have multiple groups, more than three groups. So this is what I mean is how you come to you come to pinpoint a particular statistical test which we are going to use for that particular data. So in middle group, where the data is skewed and it is a ranked categorical, you will use Wilcoxon test, Mann-Whitney U test, Kruskal-Wallis test, and Friedman's test. So it is equivalent to the groups which you are going to use. So for single group, a paired test, Wilcoxon, two groups, Mann-Whitney, Kruskal-Wallis for three and more groups. And for the last, on the right section for categorical data, you will use for one group, you will use McNemar's test. For two or more than two groups, you will use a chi-square test. And if there is a repeated test, then you will use a Cochrane test. So on the left, on what are these type of tests called? These are called as parametric and non-parametric. So what differentiates parametric from non-parametric is your distribution, whether the data is normally distributed or not. If the data is normally distributed, then the test applied is called as parametric test. Whereas if the data is not normally distributed, then the tests which are applied are called as non-parametric tests. So this is a common question in the exam. They will ask you to differentiate between parametric test and non-parametric test. So now that we have understood from this slide, we'll compare between those two. So parametric, you assume normal distribution. In non-parametric, you don't assume normal distribution. Parametric are more powerful tests, non-parametric are less powerful. Parametric, the data is in interval ratio or continuous data, as I've said, whereas the data in non-parametric is a rank order or categorical data. In parametric, the significance is easy to demonstrate, whereas it is difficult to demonstrate. Parametric will give you small p-values, whereas non-parametric will give you large p-values. Parametric will give you small confidence intervals, whereas non-parametric will give large confidence intervals. Less type 2 error in parametric, whereas more type 2 error. So we are going to study what these errors mean. Okay, so now we move to p-level significance. So as I said, when do you say the two groups are different is when they are beyond the limits which you have set. So significance test result used to find out the p-levels. So it gives probability figures that expresses the chance of obtaining a given result. So in the slide of normal distribution, I had given you the limits of normalcy, which is 2 standard deviation. Anything beyond this two standard deviation covers 95% of the variability. And so anything beyond this variability is considered as a difference which can occur by chance, or it could be a real difference that you come to know when you clinically see the effect. So p-level significance of less than 0.005%, 0.005 as a decimal or 5%. Here, the chance to have a given result is 1 in 20. So they are used in deciding whether to accept or reject the null hypothesis. If the p-value is more than 5%, then you accept the null hypothesis. Whereas if the p-value is more than 5%, then you reject. Why you reject? Because then you say that the two groups are different to each other. So let's go and understand what is type 1 and type 2 error. So type 1 error, which is also called as alpha error, here it occurs if the null hypothesis is rejected when it is true. So when the two groups are same, that means the data of the two groups is overlapping each other and there is no difference, but you are saying that the two groups are different. Here you are committing a type 1 error. Okay. So it is guarded by significance testing. As I said, you set a limit. Anything beyond normalcy of 2 standard deviation would be considered as level of significance. So here you are finding a difference when there is none. So when you are committing a type 1 error, you are trying to find a difference when there is no difference between these two groups. Ideally, you should have accepted null hypothesis because the two data is overlapping each other. But here, because of, so basically you as a researcher is not committing this error, but there must be some problem with the methodology of your study, which is giving you this type of error. And the accepted level of error is 5%. What is type 2 error? So type 2 error is chance of missing the true effect. So here, if the null hypothesis is accepted when it is not true, so ideally the study should be showing difference between these two groups, but because of the problem with the methods or problem with the sample size, somehow these two groups are considered as one group. So which is not good. So here you are committing type 2 error because you are accepting the null hypothesis when it should not be accepted. So here, how do you prevent this? By creating an appropriate power, which is 80. Most of the time, the power set is 80%. So you're failing to find a significant difference between these two groups. Okay, so let's see what is power of a trial. So power of a study is defined as a probability that a type 2 error will not be made in the study. So as we have known, what is type 2 error? It's the chance of missing a true effect. That means there was a difference between the two groups, but somehow you have missed that effect and you are accepting a null hypothesis. So a drug which could have been used for better for the patients to cure, it's not being used because you had an increased beta error. Okay, so how do you reduce the how do you increase the power of the trial? By reducing the beta. Okay, and the accepted level of beta error is 20%. So power of the study will be 100 minus 20%, which is 80%. Okay, so this is a normal power which is accepted in all studies, in majority of the studies. But if some researcher wants to be more strict, he can increase the power to 90% by reducing your beta error to 10%. Okay, but then when you increase the power of the study, again, the sample size will increase. So you have to balance between using your resources when you increase the sample size, or you would be happy to accept 80%. 80% is the norm, and in most of the randomized controlled trial all over, it is an acceptable thing. Okay, so it is the probability of rejecting the null hypothesis when it is false. Power is more if sample size is larger. It's decided at the beginning of the trial, and 80% is the acceptable norm. Now we come to the error. So as I said, there are two types of errors, type 1 error and type 2 error. So let's compare them by matching them to each. So type 1 error is also called as alpha error. Type 2 error is called a beta error. Type 1 error is also called as false positive, while as type 2 is called as false negative. Type 1 error is committed when null hypothesis is wrongly rejected, and type 2 error is committed when null hypothesis is wrongly accepted. Now, I want to simplify these two matches. So for a student, easier way to remember these three, because sometimes there is a confusion whether the type 1 error is beta or alpha. So is it false positive or it's false negative? So there is a trick to remember these three. So just keep an eye on this 1 and 2. Okay. In fact, let me write 1 in front of each other and 2 in front of each other. Okay. Now see what I'm doing. This is a simplified way of remembering what is what. So alpha error, A is the first alphabet. So that will match with 1. Beta is the second alphabet. That will match with 2. So now it is false positive. Both are false actually. Type 1 error is also false. Type 2 error is also false. So what you have to concentrate is between positive and negative. So type 1 error is positive. So you can convert this one into P. So you get a false positive. Whereas in negative, you can convert this into N. So you get a false negative. Now it's in both the null hypothesis is wrong thing is done with the null hypothesis. In one it is rejected, in one it is accepted. So concentrate on the word rejected and accepted. So in R you can convert this one into R, whereas here you can convert this into A. So this hack I thought would be helpful for the student to remember. So these are the first 3 comparable parameters between type 1 and type 2 error. Now, type 1 error finds significance when none is there. Type 2 error does not find significant difference when 1 exists. Type 1 error is guarded by significance level. Type 2 is guarded by power. Type 1 is more dangerous. Type 2 is not dangerous. Now, what I mean by this? So, when you do type 1 error is your two drugs which are supposed to be two groups which are supposed to be different, you are accepting to say that there is no difference. So, no, in fact, the other way around. You should have, you're wrongly rejecting the null hypothesis. So, in type 1 error, these two groups were supposed to be same, but somehow with the methods which you have used, you're finding that these two groups are different. So you are saying that your intervention group is good, whereas they are same. There is no difference between these two groups, but somehow you got the difference, and by making a difference, you're putting this intervention, or you're using this intervention now to the population. So in the population, you're subjecting patients to side effects of these drugs. So that is where it becomes more dangerous. Whereas in type 2 error, you were supposed to find difference between these two groups, but you could not find a difference, and you accepted the null hypothesis. So why this is not dangerous? Because it is just that more useful drug was not put in the market because the methodology did not find difference between the two groups. So this type 1 error is also called as a regulator's error, because the regulator, despite there was no difference, the regulator still gave the company the license to put that drug in the market. And investigator error is because the investigator did not do the method properly, and he could not find the difference between these two groups. So a useful group in type 2 error, a useful group was not put into the market. So that is where investigator has committed an error. So is this comparison helpful, type 1 and type 2? This is a theory question, has been asked for many times. So just give me an acknowledgement whether you have understood the comparison. I have tried to make it more simple by giving hacks. Good. Excellent. Okay. So now let's move on to the topic of confidence interval. Now, to get to the topic of confidence interval, you need to understand what is standard error of mean. So let's consider that this purple rectangular is the mean of the population. Okay, I'm not talking about the sample. Now let's consider, now nobody does a study of the whole population, but just for this particular slide, think that somebody has done a study on the whole population, and that population mean is represented by this purple rectangle. Now, let's see that all over the world, people are doing studies on a similar topic, and everybody will get a different mean. Okay, so somebody has done a study, he has found the mean to be this, standard deviation to be this, then it keeps on going, because same studies, if you see, is repeated in different countries by different investigators, and they get different results. Okay, they will get different mean value, they will get different standard deviation, and it keeps on going. You see many trials being conducted and all over the world. But what you see is that when you see the variation of this mean, it will be considered as normal variation on either side of this mean. As I said, 2 standard deviation variation will be considered as normal. Okay, so if each researcher has been getting different mean value, and different standard deviation, but still somehow they are near to the population mean. So why? So the assumption why we are doing a sampling from the population. So we are assuming that the sample we are choosing from the population is representative of the population. So whatever results we are getting from the sample should be close to and represent the population. So though there will be variation in the sample mean, still the variation in the sample mean will be considered as normal variation, and this normal variation in the sample mean of different sample is called as standard error of mean. Now, why it is important to know? It's not an error. It's a misnomer. In the word standard error of mean, it's an error is a misnomer, but it is used in all textbooks and it's a standard. So we have to come to this standard error of mean because that will lead us to finding confidence interval. Okay. So if you see, as the mean is far away from the population mean, you will find that the confidence interval has got a lot of variation. So this is away from the mean, lot of variation. But the samples which are near the population mean, you will have a small confidence interval. So that is the importance of sample size. If you have a good sample size, you will have sample mean which is as close to the population as possible. Okay. So this just summarizes what we have just said. It is a variability that occur from mean of different samples when estimating population mean. So this concept, standard error of mean, initially it was very difficult for me also to understand, but then reading again and again from different books, I got a clarity of what actually the standard error of mean means. And I've tried to simplify by the previous slide, and hope that makes a difference in your understanding. So it includes the baseline variability of the measured variable, which is standard deviation in the population and the sample size. Okay, so from at least tell me, is the standard error of mean clear? Because it is a very confusing topic in the textbook I have found. Just give me an acknowledgement whether you understood. I'm happy to repeat it if you want. So it is not clear. So Divya, for Divya, it is not clear. So let me repeat it. So what you mean by standard error of mean is, in the samples or various samples, let's say one study which is looking at difference between PCA and epidural for pain relief in knee surgery. And similar type of study, you have got, in your study, you've got a particular sample mean. Okay. Now, similar study would have been done in other institutes in India or maybe in other countries. And everybody will not get the same mean as what you have got. Everybody will have a different set of means. But all the samples have been representative of the population. Though the sample means by the studies done by different institutes or in different countries, though the sample means will be different, but still the variation in the sample means would be as close to the population as possible. Because your assumption is that whatever study you're doing is representative of the population. You cannot do a study on the whole population. But so by selecting a proper sample size and a representative population from the mean, from the population, you are actually studying what could be a representative of the population. So though you may get different means in different studies, the variation that is seen is considered as a normal variation as long as it sticks to 2 standard deviation. And from that 2 standard deviation, what we derive is called as confidence intervals. Is it clear now? Divya, especially Divya. So it may still not make sense to you, but when you go and read about it, it will make you more sense. In fact, all the topics which I have covered, once you go and read again, everything will be crystal clear to you, I hope. So let's come to the topic of confidence intervals. So confidence interval is used as a proof statements. It's preferred to p-values. If confidence interval contains a 0, the result is deemed as a non-significant. It allows estimate of positive and negative test, whether the strength of evidence is strong or weak, or whether the study is definitive. So let's come to the comparison table. So what does p-value tell you? Okay. So what does p-value? P-value tells us about only 2 things: whether to accept the difference between, or whether the 2 groups are different or not. It gives only two things. So it is a qualitative value, whereas confidence interval gives you a quantitative value. Nature of decision is only 2. Are groups different or not? Yes or no. Whereas here, confidence interval gives you a continuous set of numbers. Size of difference not indicated. Here it is indicated. Direction of the difference is not indicated. Here it is indicated. Impact of the sample size. Sample size differences may become significant with large number. So if you have a large sample, then only the small differences can be made out. Whereas interval range narrows with large sample. Both are denoting the same thing. Reader judgment here, since it gives you only yes or no, you can take it or leave it. But here, when you get the range of the confidence intervals, it will give you a more quantitative decision for you, whether you want to take it or leave it, because everything that is statistically significant may not be clinically relevant also. But with confidence interval, you have that knowledge to whether to consider this as a difference which is more relevant clinically or not. Okay, now let's take one example. So example makes things more clear. So this is a study where they compared blind tracheal intubation using either LMA fast track or AirQ. Okay, and then on the left hand side is the LMA fast track, right hand side is the AirQ, and this was the result of the statistics. So as I said before, deciding a test, there are 3 important things. One is the data type, second is the normal distribution, and third is the number of groups that are compared to each other. Okay, so here, can anybody tell me why they have used interquartile range? Anybody? So let me tell you, the central measure here is median. So why median was used? You look at this data, and tell me. On both sides, you can look at both sides and tell me why mean was not used. Because it's a time. Time is a continuous scale. But still the data here is a continuous data. Okay, because it's a numerical value, yeah. So it is on continuous data. But still, though it is a continuous data, it is not distributed. It's a skewed distribution. It's not a normal distribution. So you see, okay, see here. Okay, now concentrate here. The insertion time for the tube, the minimum was 14 seconds, maximum was 247 seconds. So see how much the data is skewed. And as I showed in the slide, when the data is skewed, the measure that you use is the median and not a mean. So this example tells you, since median was used as a central tendency, the distribution range is given by interquartile range. So again, when you go back and study, you will understand this better. So that is how in this test, median and interquartile range was used. Okay. Now these are the further slides are just going to explain you what are the different tests. So student t-test, it was devised by William Gossett, published under the pen name student. It's used to test the significance of difference in means of sample or samples. So t-test could be a paired t-test, or if you're considering two groups, it could be unpaired t-test. What are the assumptions here? The type for you to use a t-test, the data should be numerical, the distribution should be normal, and the sample size should be at least 30 or less. Okay. It is used to find significant level use by t-distribution table. It's a parametric test. Why it's a parametric test? Because it is underlying is what? It is saying it's normal distribution. So whenever you are considering, whenever the data is normally distributed, it is called as a parametric test. So types are paired and unpaired t-test. Analysis of variance, when this test is used, when you are comparing 3 or more groups, the data should be continuous and normally distributed. It checks between the group and within the group variation. And because it is using 3 and more groups, you are doing multiple comparisons and it is prone for multiple alpha errors. So how do you correct it? You use a Bonferroni correction. It's just for understanding. For your understanding, you don't need to remember. But in case in the exam you want to gain extra marks, you can add this data. Further, in analysis of variance, even if it returns a significant difference, it does not tell you which sample mean is different. So let's suppose you have used 3 or maybe 4 groups to compare. The analysis of variance will tell you that these 4 groups are different from each other, but it will not tell you which group is different. For you to know that which group is different, you have to go and do a post hoc analysis and use Tukey's on Newman-Kuhl's test. There are different types of ANOVA test. One-way ANOVA test when you are comparing one parameter, two-way when you're comparing two parameters, multivariate when you're comparing multiple parameters, and repeated when you're doing similar test before after, like a paired t-test. So the take-home message, randomization and blinding are key methods. Sample size should be large for good power. Data type is of fundamental importance. Parametric tests are the most powerful test, but the underlying to that is normal distribution. Confidence intervals are preferred to p-levels. Understanding basic statistics helps you to read the result section in the published papers. Thank you. I hope I have been able to explain in a simpler way. I don't think there is any simpler way than this. So let me get a last acknowledgement for everybody. How is the understanding better before starting the Zoom meet? Has the understanding improved? Say yes if it is improved. Excellent. I was worried about somebody will say no. Okay, over to you, Kalpana.
So I think, Dr. Shashank, I think you made this topic really simple for our students, and really we even, I mean, people like us also who now lost touch with this. It's just beautifully explained, and you've covered at least most of the exam questions which have been asked. I think that was just wonderful. So I'm sure all of our students have been well abreasted now with this topic. If there is any question, you may please put it in the chat box so Dr.
Yeah.
Sashank can answer that. And while your questions are being written down in your chat box, can I request Dr. Halbe to make any comment? And I also have with us Dr. Lalita Naik and Dr. Dhaigude Madam, if they have any comments to make while the questions are being written down. And students,
Hi,
don't
madam.
hesitate to put down your questions.
Hello, madams. Good night, I would say.
It was excellent.
You kept us awake. Not good night.
Very simple, very actually, this is first time I would say, I mean, I'm not ashamed to say this, is that first time I understood the difference between confidence intervals and p-values. All these years I used to think why there is, I used to skip that in the, this, I have understood and really done very well. Thank you. Thank you.
So if you see all the recent papers, they will not give you only the p-value. They will also tell you about the confidence intervals. So by getting the data information from the confidence, it gives you more confidence. If the confidence intervals are way high, that means that particular trial was not done properly. The inference is that.
Right.
Naik, madam?
Yeah. Dr. Budhakar, can you hear me?
Yeah, I can hear you, madam.
Yeah. I totally agree with what Kalpana said, You made this very dry subject very interesting and very simple to understand for students. All this was not done when we were postgraduates. Statistics was only 4 lines. इतना सारा तो नहीं था. It is so very interesting. You made it very simple. What I want to request you,
Yeah.
Would you like to publish, write a book, statistic made simple for medical students?
Basically, I got the knowledge by reading multiple books. It's given all in the books. But it's when you present it, it makes it more easier for me to make students understand about it.
Yes. Actually, what you said is sometimes it reads multiple readings.
Yes.
So
basically, I would say,
yeah.
So basically,
instead of
this
one person sitting and reading again and again, if 3-4 students they discuss among each other, it becomes like it is permanently etched in your brain. So that discussion also is very important and very nice. Enjoyed, really
Thank
enjoyed
you.
it. You really made it very nice. 2 days ago, I had a very beautiful session on meditation, and today you are.
Thank you. So for students, I would say that after this, go again and read the book. Hopefully the topics will be more clear to you, and you should do that not just before the exam. Give it a time because it's a difficult
Exactly.
subject.
Yeah.
So you should do it when your mind is relaxed.
Yes.
And those who have listened to this talk, I'm sure when you read the textbook, the things will be more clear.
Yes, absolutely. Thank you very much, Kalpana. Thanks a lot for arranging this lecture. Really very nice. Very nice.
Thank you.
Dr. Dhaigude, madam?
Yeah. Hello, Dr. Budhakar.
Hello, madam.
It's a very complicated topic. We used to sort of give it as an option.
Skip, yeah.
This was years back. But I think you made it very, very simple for us to understand even at this stage. So I think statistics is getting a lot of importance everywhere in every field.
Yes.
So medicine is not the separate one. So we also should know much more about the statistics. And when we do the trials and all the experiments and everything, it's extremely important. Thank you so much. Thank you.
So for students actually who have started doing the trials, it makes them fun to know all this right at the beginning. So they can enjoy the trial and understand it better. And also
Correct.
for exams, there are very specific few questions they ask on it. But yes, you need to have a relaxed mind to understand this.
There is a question for you to suggest a few books slash authors or basic and medium level to read and not forget the subject for long.
I'll tell you, I have some books here. So this is a, one book which I liked very well. I think it's not visible, is it?
No, it's not visible.
I think I'll have to hold it near to me.
What is this book?
Focus utare baba.
Can you
I
hold
think
it
because of
closer?
the okay, it's called Making Sense of Critical Appraisal by Olazide.
But
And there is a
Could you just type it in the chat box, Dr.
yeah,
Budhakar?
yeah, in fact. I'll just write.
I think that's the reason what Madam's suggestion was.
Uh-huh.
If you could make a small booklet, of like
I understood
that
what
you have done, of this only make a small booklet with only all these things relevant to us when we are writing a thesis or a paper,
Correct.
with relevant exam questions, of course, what you have covered. This would be that will be really helpful because that will be one go-to book that they can go to.
Yeah, I think that is not a bad idea because most of the books actually don't give the correct examples to correlate that particular topic. So in many books, I think what is lacking is for each topic they should have given an appropriate examples also,
absolutely.
which is
Yeah.
not
You
there, and
understand better.
that's why it
Yeah,
makes
there are
a very
many
dry
examples.
topic to read from textbooks.
I think I'm going to take or rather, I'll have the audacity to say, please do write a book and you will have a forward written by Dr. Nayak, Daigude Madam and Alka Halbe Madam. So please do that.
Yeah.
There was one
It
question.
will be wonderful.
Yeah.
Yes.
There is one question, role of audit in anesthesia.
Role of audit in anesthesia. Actually speaking, it's similar to what we do for trials, but it's not as formal. Where you don't have to give ethics committee approval for that, but it's a good habit because whatever standard practices are there, it gives us a confidence by doing those audits whether we are up to that standard or not. It just helps us to correlate our practice with what is the standard practice. So yes, in majority of the cases you should have an audit. In fact, in our hospital the research department has made it compulsory for the department to have at least one audit per year. So yes, means audit because that gives the student understandings also how things are need to be done, and it should not be just one audit. The cycle should be completed as well. So once you do the audit, you compare that with the standard method of doing it, and then you see what are the lacking factors, and then you do a re-audit. That is called as a complete cycle.
So I don't see any more questions now. There's one more. Bhavya wanted to ask about, sir, I was asked about PICOT technique while presenting a paper in GAC. Can you please elaborate its role?
I'll have to read. I don't know. So I'm as ignorant as you.
That's very honest of you. Thank you. Okay, so Bhavya will go through this and get back to you on your question. And I think if there are none more questions, maybe call it a evening and a good weekend ahead now.
Yes.
Thank you, Dr. Budhakar. I really thank you from the bottom of my heart for having this lovely lucid lecture for all of us. And I hope next when I call you, it will be for the opening of your book, which can be given to these
Thank
students.
you. I should take it seriously.
Please, it will really be very helpful to all of them. It will be like a quick reckoner rather than, doing
Okay.
many books.
Yeah.
Thank you so much.
Okay,
Thank you
Kalpana.
everybody for
Thank you,
joining us.
madam.
Thank you,
You
Dr.
can
Geeta.
call it synopsis.
Yeah, true.
Yes.
Thank you and good night.
Good
Yeah,
night,
thank you.
everybody. Thank you.
And
Thank
have
you.
a nice weekend, all of
Yes,
Have a
you.
nice
madam.
weekend,
Yes,
everybody.
madam.
Yes, yes. Bye-bye.
Bye.
Bye.